All right, everybody. Welcome to Hygiene Elevated Conversations and Innovations. Today we've got Kari Carter with us. Thank you so much for being on the show today.
You're welcome. You're welcome.
Um, I just want to share with everybody that we saw you in Florida last year
Oh, at RDH on
at
the roof?
the yes,
Okay,
yes.
okay. Thank you.
And we've just been following you ever since then.
I love being there. I can't wait to go in a couple of weeks. I won't be a presenter this year. I'll be an exhibitor, and an influencer for RDH magazine. But it was a great conference, and everyone was very supportive, so that was good.
Awesome. We're going to be there this year. And we're doing the hygiene, I keep saying elevated, but the evolution portion.
Oh, that should be nice. I wanted to go to that. I wasn't able to last year. I won't be able to this year. It's just a lot for me having the 2 year with all the time off and everything.
Oh, yeah.
But we'll be staying after the conference a little bit because I'll be speaking in Nashville on Tuesday for the Indian Health Services Conference. But hopefully one day I'll be able to go to the evolution part. I think it's very important for our colleagues, and it can really help them with the different career opportunities that they're seeking.
Awesome. We're very excited about it. So we'll see what we get to do this year.
That'll be good.
So, Kari, I wanted to start out by saying I also love school supplies.
Yes.
The smell of going into Staples or any office supply place is just intoxicating. So yeah. I look forward to back to school to start like going through the aisles of like the latest notebooks, pens, all the things.
It's quite fun. I do mention that in my diversity course. Yes, I do love school supplies, and my kid is old enough. He loves them too. It's just that he won't just put it on the page. I have to watch him and like hold his leg because he wants to like take off and go into, do the new floors, porcelain tile floors, and try to mark up that or the walls or something like that. So yeah, I love them, but it's like now I'm making sure they're washable and everything.
Yeah, exactly. Thank goodness for new technology that you can buy the washable, wipeable, the ones that only write on certain surfaces.
Yeah, he has that. Yes. He has that as well, where it's just like they have it pre-colored or something. He just puts water, so that makes it easier in my life. So,
oh yes, love them. All right, well, that was not part of the intro, but so tell us about yourself. Where are you?
So I live in West Palm Beach, Florida, and everything. I don't know. I didn't have to tell West Palm Beach, but I live in Florida. I live in Florida.
That felt like a brag.
Yeah, it's not a brag. It's just like, don't come and find me, crazy people, if you're crazy. Everything. But I mean, you can Google me anyway. We could Google everybody. But so I'm in Florida.
Right.
I've been a hygienist for 18 years. I went to Palm Beach State College. First, I was a dental assistant. So I've been in a dental field for 25 years. So I love everything that I do, clinically and non-clinical. As you mentioned, you saw me at RDH on a roof. So I'm a public speaker. I was speaking at that event and being an influencer. So I love being in Florida. It's hot, but I love it.
It's my husband's favorite place to vacation. So we have done a lot of road trips to Florida from Utah.
That's a long road trip. That's a long trip.
We take 3 weeks. Mental health, we take 3 weeks. We take our time and we take our camper and we stay at farms along the way and just enjoy and see the country.
That's nice. I haven't made it to Utah yet, but I know how beautiful it is. So I hope to come out there one day and see my colleagues and everything there.
Always welcome.
Yeah.
Yeah, the weather's a lot more tolerable out here.
I know.
Yes.
And I would like to see it and everything and visit. It looks beautiful, and I like everything that you guys are doing and helping the community and the colleagues and everything. We all play a role in uplifting our industry. So hopefully I'll be out there one day.
That would be awesome.
We'd love to have you.
So I think Joffrey had a question that she wanted to kind of get your opinion on. It was a last minute question we added.
Okay.
But
yeah, so Kari, I want to ask you about quiet quitting as dental hygienist. Like, what does that look like in the operatories?
So I looked that up, and to me, I'm just going to speak for a hygienist standpoint. I don't think most of us are doing what they're calling quiet quitting. I think most hygienists, we work very hard as hygienists, and we almost work too hard. I know in my career, like I went above and beyond, and I helped out in the front and in the back. I did my job. I helped out with other people. And I think that just a lot of hygienists right now are just kind of tired of being taken advantage of. So I don't know if people think that's quiet quitting, that they just don't want to be taken advantage of, or do all the different tasks, or help everyone else in the office. And then when we need help, it's crickets and everything. So I think that more what's happening is that a lot of hygienists are looking for different opportunities in dentistry, or they're looking to work in different avenues in dentistry. So in hospitals or in prisons or schools or sealant programs, they're just looking for more because of either burnout or bore out or not feeling appreciated. So maybe what hygienists are doing is, it's not relating to patient care, but they're just tired, I would say. So maybe think about it. If you are trying to change an office, and I've been there, we are trying to change the office from, not following perio procedures and protocols, and you're doing your best to make sure that the patient is having an updated perio chart and x-rays and everything, and then maybe a doctor says just do a prophy, and maybe you're just tired of the fight, and so you may just stop fighting and just go along with the program until you can get a better job or out of that opportunity. So, and that's what I would think some hygienists are doing, is that they're just like going along with stuff instead of continuing that fight because they're tired of it. It's mentally and physically fatiguing.
Yeah, I like that. When I was thinking of like what is quiet quitting in the operatory, I kind of thought about it as like revenge to the practice owner or the doctors that have upset them so much a little bit. And quiet quitting to me was like not producing as much, just to kind of like get back at you just a little bit. Like not harming patients, not harming the care, right, but maybe just like not coding as much as you could have been.
Like not helping out.
And I don't encourage quiet quitting at all. And like you said, maybe that's not exactly what's happening. But I want to give everybody like advice on an exit strategy and how to like move on with their career in a better manner than being unhappy where you feel like you have to do these quiet quitting situations.
Right. And so I understand that. So I speak about burnout. I speak on other topics, but I mainly speak about burnout. That's what I'm known for. And that's what I'm trying to do as well. So I have a conference that I'm putting together in August, a virtual conference to give people different, hopefully, opportunities or how to get out of that mindset that they feel stuck. That's what a lot of people are dealing with. They just maybe feel stuck in the situation. I don't think most people want to put the patient in harm's way, or they're not doing their best. But I can agree that maybe sometimes hygienists do feel that the doctor is taking advantage of the patient and having all these different procedures that aren't necessarily necessary. And because in most states we're not allowed to diagnose, but at the same time, so we may have our own philosophy and feel that what the doctor is asking is too much. Or maybe we've changed. So I know that in the past, when I was very heavily involved in clinical, I was a very productive hygienist, and maybe the patient was on the schedule for a prophy, and I did sealants as well. I managed my time that they would have that, and So the patients got what they need, the office got more production and everything. But if I'm working in an office that is not treating me well, or I'm having all these issues, maybe I'm not going to push that, where I'm going to work as hard to do that and everything. So I can understand both sides of the story, where the doctor may not be happy, but at the same time, if they're not having a positive work culture and having leadership, then I may not care as much and everything, because they're not helping me out. But I think what hygienists need to do is, because of the shortage in most areas, is really try to find an office that aligns better with how you feel, so that you don't feel like you have to, that you're stuck, or that you're not doing the best for the patient or the best for you. Because when you're not working at 100% and everything, a lot of times I've worked even more than 100% and everything, but that can be draining if you're not feeling appreciated by your employer. So I really encourage hygienists to, if they're not happy with that job, to look for another job, or to see a way out. What is gonna make them happy? If they're not happy with doing clinical hygiene anymore, then look for different avenues or non-clinical opportunities. And that's one reason I really encourage people to network, because that's how you tend to find more non-clinical opportunities, is by talking to your colleagues, going to meetings, going to RDH Evolution, going to different places that really can change your mindset and open up what is available to you. But if you're just stuck in that office and you're just constantly talking to other hygienists who are stuck like you, then it can be hard to find a way out.
That was an excellent plug for RDH Evolution.
They should have sponsored us, right?
Hey, ask them.
They are.
Ask them.
So, kind of on that thread, how did you kind of get to the point of like, okay, I need that next step? What was that sign for you?
So I dealt with burnout and everything. I didn't know that's what it was. And burnout basically is workplace stress that has not been managed correctly. That's the World Health Organization's definition of it. And it can affect us mentally and physically. So sometimes we are going to, the doctor because we're having like GI pain, or we're having migraines and everything like that. And it's not that we're actually physically sick, is that we are dealing with the symptoms of burnout, and it's manifesting in our body as that pain or mental illness, or we're crying in our car, or going off in the office. I didn't do that, but crying in the car did happen. And so at some point I left the job that ultimately caused me to really be burnt out. I've been in the career for a while, and I've dealt with different situations throughout the career: bullying, gaslighting, discrimination, a lot of different things I dealt with. But ultimately, one of the last positions I had really almost broke me and everything. It just almost broke me. And so I left that position. I went to a job that was much easier for me, but didn't challenge me. And so that's ultimately when I started thinking about, what do I want in my career? Because I knew that job wasn't going to satisfy me. But at the same time, I knew I needed to pay my bills, but I needed to be happy. So that's when I started writing my book. I wrote the book, The Ultimate Guide for Dental Hygienist Burnout. I got coaching from Jasmine Haley. She's a hygienist, but she mainly teaches people now how to go into the speaking business or be entrepreneurs. So I got coaching through her. And I really was able to map out what I wanted my career to be. And so that transitioned into me becoming a speaker or becoming a professional educator. Now I work with Arm & Hammer in Baigea. I write for different companies. I'm a consultant. I'm a coach. So I do all these different things. But that's for really, I had to self-evaluate and see what I needed to do. What was the root of my burnout? And most of it was boundaries. I really lack boundaries, and I let people take advantage of me. And I think that's what a lot of hygienists do. We want the patient to be happy. We want the office to be happy. And sometimes we don't think about what's going to make us happy. And so we keep taking more patients, and fine, we'll work through lunch, and fine, we'll work later and everything. We don't want to do these things, but we don't want to be seen as someone who's mean or, causes problems, but we ultimately are hurting ourselves. So I really worked on that. I continue to work on it. I go to therapy. I advise people to consult a therapist, because a lot of these things are learned behaviors, and that we put ourselves last. We put the patient first. Hygienists don't go to the bathroom, we don't eat, we don't do all these things, and then we end up burnout. So that's mainly what's guided me, is getting the needed coaching, self-evaluating what I needed to do, and then putting in the hard work, the hustle. Because sometimes we just complain about what we want, but we don't do the hard work. We don't see what we need to do to get out of being burnt out.
Kari, I wanted to say I love that you're an advocate for therapy. Right before we started this call, Amanda and I were talking, and I was like, "Oh, my therapist recommended that I start making to-do lists," and she's like, "Oh, that's such a great idea." But that's something that I often coach hygienists to do as well: is get a therapist, have an outlet. It's very healthy, very helpful, and also I feel like your story and my story align a little bit. Like, you got pushed to that burnout brink where you're like, I need to figure out what I want, right? And for me, it was like, I felt like I've mastered the art of hygiene, and now I'm really bored. And so for me, it was like, if I want to help as many patients as I possibly can, I need to start helping other providers. And that's how I got into consulting and coaching, all of the stuff I'm doing. And I just feel like you and I, we both hit that wall. We're like, okay, it's time to do more.
Right, because many healthcare professionals, we get into the profession because we want to help others. And so once I felt like I was a lot better, I won't say healed, because I feel like we're always in a position of we're trying to continue to heal ourselves. That's why therapy is important and everything. So you're never like, fixed or whatever. You're always trying to work on different things. But that really helped me to see that I wanted to help others. I thought it was just me. For the longest, I thought it was like, what is wrong? I keep going to these jobs. I look in RDH magazine, and they're like talking about how great the profession is, and they're showing these awesome offices and like the unicorn office. And I'm like, why can't I get that? Why am I always complaining to everyone about my job year after year? And that's when I felt much better, and I was doing the work on myself, because there was things I needed to do. I wasn't networking, and I wasn't going to conferences. I can go online in Florida and just take CE courses for free on any type of professional website or toothpaste website or whatever like that. And that's great. I'm not saying I was even halfway reading all the literature. I was just finding the answer sometimes. It's bad, but it's true. It's bad, but it's true. But as opposed to actually going to conferences, as opposed to investing in myself and having to pay for stuff, free CE is great, but sometimes you got to pay to play to really learn what you want, or to get hands-on learning. So there was things that I needed to do instead of just, complaining about my situation and everything. And so that's what I tell people to do as well, is very important. And I definitely wanted to help others. So once I found out, it's not just me, it's an industry problem, I'm like, let me help everyone out. And so that's why I created my Facebook group. That's why I did my book. That's why I go and I try to help everyone out as much as possible. And then I have to make sure I don't get burnt out doing that, because I tend to want to help everyone and everything. But at the same time, I have to make sure I instill boundaries, and that I'm not, taking away time from my family and everything.
No, I love that. It's so hard to juggle everything.
That was wonderful.
I've got 2 kids, and I feel like on my days off, I'm like Uber mom, just drive everywhere. So it's so hard to even squeeze in the podcast sometimes.
Well, my kids too, so he's young, but it can be difficult. It can be difficult. Childcare can be difficult. So I don't want him in daycare, but yet I don't have a lot of family around to watch him. I do have friends, and I am getting help at times, but it can definitely be difficult. And that's one reason why so many hygienists want different options, because we want to spend time with our kids. And some offices aren't as flexible as they could be with our schedules. Like if you're having a hard time finding a hygienist, maybe you can split the position, and you can have someone who's available in the morning, someone who's available more in the afternoons or evening, to make it where they're sharing a job and everything. But unfortunately, some offices, they won't think of that mindset and everything. They want something a set way. And they could have had two great hygienists who are able to be happy and do 100% and not quiet quitting. Because think about it, if you want to go to your kids whatever it is and they're like, no, you can't go, are you going to give 100% that day? You're going to be resentful because you're going to feel like you should be there and, feel guilty that you're not there, but feel stuck because, if you call out or whatever, you can't quit or, so there's a lot of different emotions that are going into it. But at the same time, yeah, my kid sometimes he's like with me, like even yesterday I had to do something for work and he was with me in his jogging stroller, or I feel bad sometimes he's in his jogging stroller, like right now he's in his jogging stroller and he's got his tablet and he's got this TV, so it's screen time and everything like that. But these are things that mom has to do so that I can hang out with you. So it's a lot being a hygienist, being a parent, that we're dealing with all these different emotions at once.
Yeah, and that's actually why I chose hygiene. I was like, told my husband when we first started dating, listen, I'm only working part-time. I want to have a family and I want to be present. I am growing up, my mom, she worked 2 jobs. She did her best. She was busy. My dad was busy. And I thought, I want to do it different. And that's why I chose hygiene. And it's ironic now that I work like crazy hours and because I love it. It's not what I saw for myself at all.
But that's why I became a hygienist as well. My mom suggested that I become a dental hygienist. I was going to become an environmental engineer, but my mom really suggested I become a hygienist. And I don't like math. My dad's an engineer. I like science, and I like writing, which is why I wrote my book and everything. And I like talking, which is why I talk so much, and I'm a speaker. So these are all the things that I get to do now, and make an income from, and be able to be authentic in who I am and everything. So I also became a hygienist because I was like, okay, I'm gonna get married and everything. I got married younger, and I'm like, what job can I have if we have kids that I could be there as well? Because my mom was there for the most part. She worked sometimes and sometimes she didn't. It just depended. And then she relied on me a lot to help with my siblings. And I wanted a job that I only had to work 2 or 3 days a week. And my husband, he's a firefighter, so he only works a couple days a week. So, I'm able to be here at this time. I'm completely blessed and able to be here at this time with my son. And that's mainly because of things that I put in place prior to the pandemic, before I knew I was going to have my son and everything. And so that allows me to do the things that I'm doing now. And, I feel really bad for people who want the same and everything, because had I not positioned myself like this, I would have to be at work to help financially with my household, because we have bills, we have a mortgage, we have different things. And even with all that I do, it's still hard because, everything's expensive these days. So.
No, it is very expensive, and things are getting even more expensive as we go. And then that's trailing my mind to think about the change in hygiene pay. Like this morning, I woke up to an article that was like, are hygienists worth their pay? And I'm like, absolutely, we're worth it. And I just thought, I can't even believe we're having these conversations. Like, we are providers. The world is expensive.
Anytime I go to the grocery store, I walk out, it's like $100. I'm like, what did I get? And I'm like, it's like, or I'm trying to go to different stores that are less expensive. But my mom, prior to us getting on this call, my mom and I were talking about it, and my siblings, and the hard times that everyone is having, and groceries and everything like that, and someone's hours getting reduced, and it's definitely expensive. And in my Facebook page group today, someone who's a non-hygienist basically said we should be thankful that we have jobs as hygienists and everything, instead of complaining about basically our lot in life. And that blew up. But basically, if you think about it, we do a lot, especially if the office is allowing us to really work in our full capacity. So if we're allowed to have a productive hygiene department and to manage patients' care, and we're listened to, we are usually very productive hygienists, and we're the lifeblood of the practice, and we're worth everything. because if you're able to pull your numbers at your office, you can see how much you produce for that office and everything that you do. And that's not just your chair. That's getting patients to do the necessary work in the doctor's chair. So, a lot of the times what we're doing is allowing everyone to eat. So when they say, are you worth it? Or hygienists want more money and everything, I'm going to always go for the hygienist because we deserve it. For the most part, I know hygienists to be hardworking. There's always an outlier. There's always someone who may not be, or isn't keeping updated, or is doing the bare minimum. But most hygienists are constantly doing what is right, and they are saving the office from litigation. They're referring the patient to oral surgeons. They're making sure that things are doing properly and everything. So yeah, we're worth it and everything. And I think sometimes when you are in dental forums and some dentists are really bad mouthing us, they're usually the ones who are saying, no, just do a prophy. And you're like, they have active perio and everything. And you can even get the patient on board to do it. And they come in and they're like, no, we'll just do it. You're like, they were gonna do it. What are you even talking about? So it's more those offices that are that feel that way. That the doctors aren't really wanting us to do what we know we can do. I have a friend, and she produces so much for her particular office because the doctor leaves her alone. The doctor trusts her and allows her to do what she can do. And she's being ethical. She's not a hygienist who's just doing stuff to get bonuses and everything like that. So I just say that, allow us to do our job and everything. I think in my book, I may have Jerry Maguire because I do a lot of movies, and I just feel like when he was telling Cuba Judy, let me help you, let me help you. And that's just what we want the dentists to do. We want to work. Brush with Brit had a great quote on her Instagram when she says that we want to work with the dentist, not for the dentist. So we really want to be co-therapists with the dentist to do the best for the patient. And that's why we're worth it. So if you have a hygienist who's not doing anything, yeah, that's just like any employee. They're not really worth what you're paying because they're not trying to do anything. But if you have someone going above and beyond, or they're constantly educating themselves, and then not paying them properly is not the best thing. And that's why so many hygienists are trying to leave the field or becoming entrepreneurs, because we have this entrepreneur mind and spirit. And if you're not going to let us do something, okay, we're going to go find a way to do it ourselves somewhere out there.
I'm a little curious, Kari, are you more in favor of private practice or DSOs?
I've done them all. So honestly, I've done public health, private practice, and DSOs. I've worked the longest in DSOs. So the job that I left that about drove me crazy was a DSO. And I actually do like that particular DSO's model and bonus structure and benefits and everything like that. But the thing about DSOs is it can almost be like a private practice where the owner is, the owner of that particular office you work at, or they may own several offices. The DSO may have a certain way that they expect them to treat employees or act, but that owner may not actually implement that. And so that's the problem with DSOs sometimes. But I do like that a lot of DSOs seem to at least follow protocols better. So I like rules. I'm a rule follower. So they seem to be like, when's the last time the patient had x-rays? And I know even some hygienists don't believe x-rays need to be, I believe we need to take x-rays and everything. So, or, they want the perio chart. They want the patient to have the correct treatment according to the updated guidelines. So if the patient's a perio patient, they have perio therapy, or, they have prophy or whatever. So I like that they are at times more on the ball. Now, sometimes they get a bad rep because some people think they're more aggressive, but I'm one who would rather them make sure the patient does what needs to be done than some of the private practices I've worked at where I basically was made to do bloody prophies. So that's my thing. It could be, any situation could be good or bad. It just really depends on, it's per office, you have to say. So I can't say, oh, this DSO is bad or they're bad for the industry. because I've worked in some private practices where I'm like, you guys are crazy and everything.
Oh yeah.
Yeah, and everything. So, and the thing about private practice though is that sometimes you don't have the benefits of DSO. So think about if when the pandemic hit, or if you get pregnant or something, if you work for a DSO, you have, because there's usually more than 50 employees, then you have more backing, or maybe there's HR, or you have more things that you can really make sure you're being treated appropriately and everything. But if in a private practice and everything, there's a lot where they can fire you at any time. And, there's a lot of, you can get fired at any time in Florida, but there's a lot less things that can go work for you at that, basically.
Yeah, and for me, it's like I can't say which one's better, because I have now realized, like, no two DSOs are created the same. No two private practices are created the same. You've got to just like experience it, feel it out, see if you fit in there. My very first office I ever worked for was a DSO. I lasted there for about 4 years, and it just like wore me down. Like that, I was like, I'm never gonna go DSO again, ever, ever, ever. And then I switched to private practice, and that was my first private practice office. And I was like, what is going on in here? You guys aren't diagnosing perio.
Exactly.
You're not offering fluoride. And I'm like, I can't live like this.
Exactly. And that's what I'm saying.
And
yeah, that's exactly what I'm saying.
4 years later, now I found myself at a DSO again. Yeah. And I'm like, oh, this place ain't that bad.
And I learned the most. I think I became the best hygienist at DSOs because, I love SRP. I really got to learn SRP. And it's not that it was overtreated. It was like I had some of the worst cases in my life. I went home smelling ridiculous. My car vents need to be changed, because of the smell of perio. My husband's like, why do you stink? I'm like, why do you ask this question every day? So I do a lot of SRP and perio maintenance and everything. I loved it. And so I love that we provided optimal treatment for the patients. I love that they did Velscope. I loved when we got the iTero scanner and everything like that. So that's what I loved. I became lead hygienist in most of those locations because of that. So for me, I don't have a problem with DSOs. It's just usually it's the office environment, and that's at any office. At any office, you can get someone who's a bully or someone that they won't get rid of because they need them in some capacity. It could be a rival hygienist, but she's making good money for the office, so they don't really get rid of that person, or a dental assistant, lead dental assistant, or whoever it is. So the thing, then you go to another office, like you said, and they're not perio charting, and they're acting like because you want to do things properly, like, oh, you're aggressive, or you're just trying to make money, or whatever. And it's like, no, I'm just trying to do what's right for the patient. Or, can you do an oral cancer screening here? Or, so that's the reason I like DSOs a lot is because for the most part, I like that they're doing the proper protocols for the patient. And I like that. I like that someone comes in, hopefully, and does the treatment planning for the patient, and the patient knows exactly what they have to pay and everything, instead of just the office being afraid to lose a patient because they don't get as many patients as a DSO and doing supervised neglect. So that's my deal. Will I work for a DSO again? Maybe. Right now, I just mainly temp. So I do all my non-clinical things that I do, and I'll temp, especially for a dentist that I know or something, or, I temp with a different organization or something. I don't know when my child goes back to, when he's old enough to go to school, and if I go back to clinical mainly and everything, what I'll do. But I do like DSOs because even with temping at a dentist that I know and like, I was like, what do you mean you want me to do 4 cards of SRP in an hour in a perio chart? Like, what? Oh, no. I'm like, what? No. And the thing is people think that like, oh, DSOs make you do that, but I was able to make my schedule how I wanted it. I could see as many patients or I needed to a day, or I can, say, okay, this patient needs 2.5 hours, or this patient is only a denture or whatever in these 30 minutes. So I was able to really dictate what I wanted on my schedule. It was more like it was my own office in my own room, or as opposed to the private practices, they'd be like, oh, you have an hour for a new patient and do all this. What? So it's you know, it's us making sure we align ourselves with what's best for us. So that could be public health, that could be certain private offices, that could be a DSO. It's just making sure that that's working out for us. And if something's not working out for us, speak up. And if that doesn't work out, then change our environment.
So would you kind of say figuring out
burnout? Like if you see signs
like
and
what is
symptoms
best
in your
for
life,
you?
Both of you guys are talking.
But
go ahead,
back to
Amanda.
the idea of like what is best for you. That sounds like it's kind of the best way to prevent burnout, not just staying stuck.
Yeah.
But maybe for that hygienist out there that is like, oh, I'm staying for X, Y, and Z at this practice, what would you say is like, this is your sign, get out, you're gonna burn out?
I mean, sometimes when you're in it, it's hard to see it, right? It's easiest for someone to like type the whole crazy scenario in a Facebook group and everything. I think there was one, I probably have it in my phone snapshot. I have too many pictures in my phone, but there was one hygienist who went on and on, like she saw like 20 patients a day and like I think 15 minutes per It was just craziness. And I was like, and she was like, but she's afraid that there's worse out there. And I was just like, honey, there's nothing worse. Like, I don't know other than if you're getting like sexually or physically abused. I don't know. I have my own Facebook group. I look at stuff all the time. I hear the worst, but this is the worst thing I've ever heard in my life. Like, what is your side? I mean, it's almost like, what's that Foxworthy, the comedian? Here's your sign and everything. Like,
yeah,
it's,
exactly.
you know, but when we're in it, it's harder to see what's going on. And it's hard. It's easy for us to tell someone on Facebook, quit your job. But there's other variables that may be there and why they're not quitting their job. So people need to almost write down what is going on. Because maybe if they see it on paper, then they can actually be like, wow, I'm allowing this to happen and everything. You know, oh, I'm allowing myself to be bullied. Oh, microaggressions are going on. Oh, they said they're not going to pay me for these meetings I have to go. Oh, I got to hang out with them at work or I can't have my job. You know, there's so many. Start writing it down. Have a journal. And then maybe you'll come to your senses. It's like, okay, it's time for me to look for better and everything. And maybe you can't right away, but make a plan. So if that hygienist is in a rural place and like a small town, okay, maybe they may have to start going to school virtually to, you know, add to their degree to get something higher. Because some of the different non-clinical opportunities, they do want you to have a higher degree and everything. So maybe they can find something they can afford and one or two classes a semester or something like that. But work towards it or start networking and talking to other hygienists or volunteer a little bit. So do something to try to get out of that rut and everything. It's going to take work to try to get out of it and everything. It took time for when you got into it, so it takes work to get out of it. So that's mainly what I can say about it.
I think you made a point earlier in the conversation about investing in yourself and like having that point where you're like, okay, I need to start investing, whether it's CEs or networking opportunities, but having respect for yourself and your profession to make those investments and to advance yourself professionally for your patients, whatever. But I think there's a lot of self-respect that I just need to have. And you make that case very well. Respect yourself.
Yeah, no, invest in yourself. And that's what I tell hygienists to do. Like, invest. If your body hurts, try to get some loops and everything. They have payment plans. I think Illumina does sponsor me, but they do. They have like $1,000 off right now, I think, or whatever company you decide to go with. You know, do your research, and then you know What about a saddle stool? Have you tried out the different saddle stools? How are you investing in yourself? Is it going to conferences? Is it doing CE? Like even with my upcoming course, I have people pre-register and I haven't put out how much it's going to be. And people like, it's going to be free. And I'm like, I'm diplomatically saying no, but at the same time, I'm thinking like, if you only knew how many hours it's involved with this and how many people I'm contacting and sponsors and the back and forth and everything, like yeah, I'm gonna make it reasonable, but at the same time, like you have to invest in yourself. I've done webinars for different companies, and I do it myself. We sign up for free CE all week long, right? And then maybe we don't take it all the time. Right. Something comes up. But if you pay your hard good money, right, you make sure you don't miss it, right? Because you paid whatever it is.
Right.
But if it's free, you're like, oh, it was free anyways. Maybe they'll do a recording. So like I've done where people, like 600 people registered and half usually show, whatever it is, half show. And life happens. I do it as well, like I said. But when you invest in yourself, you care about those loops more. You care about your instruments. You care about your seat. You care about your degree more. But if you're not willing to invest in yourself, why should you expect an office to invest in you? If you want high money, you do have to invest in yourself to be that high hygienist that the doctor feels is worth that. Or because, they will at some point have options to choose from. Right now, there may not be as many options because everyone's looking. But at some point, they're going to be very discreet, like when I graduated, and it was hard to get a job and everything. So you have to really set yourself apart from everyone else. So what are you doing right now? Instead of complaining like, oh, they want me to scan. I don't need to want to learn the scanner. Learn how to do the scanner. Because even if you don't like that job, you being able to scan patients, when you go to the next job, you put that I can do the scanner. I can do it in X amount of minutes. So learn these tasks while you're on the job you don't like until you can get the job you want so that you can have that on your resume.
I love it. Love it.
I want to just add to that. Like, I like that you're not working for free and you're not putting things out for free. That was kind of like one barrier I took when I first took the consulting route was how do I not work for free?
Right.
I felt like I was trying to obtain the client, trying to get the sale. I'm like, I think I just gave that away for free. Like it was a tremendous learning curve had to not work for free.
Yeah, it can be difficult.
Because the value that we have that we can bring to a practice, it's worth something. It's very valuable.
Yeah, it can be difficult because we tend to want to help people, help everyone. I mean, and I have to hold back in my DMs at times because people DM me all the time or they want to have a meeting or a chat or pick my brain, which I really hate that term, pick my brain. It makes me think of like aliens or something. I hate it and everything. And I have to create boundaries and I have to be like, okay, free coaching call, 15 minutes because I pay for this. I work hard. You have to research, like to put on a 3-hour presentation, it's a lot and everything. There's a lot of references and researching and investing in your accreditation and making sure you're doing everything right for the accreditation and contacting and talking to a million different people. So yeah, we have to make sure that we're getting paid because we have to support our families, and not everyone understands that. But we know as hygienists, we like to be paid. We don't want to work for free, right? As soon as I enter that office, I'm clocking in. And as soon as I'm leaving, I'm clocking out. But that whole time, I'm getting paid. If I'm not getting paid, I'm not there. And don't talk to me. I'm in my car and everything. But, it's the truth of the matter. So we do have to, that's why coaching is important, having a coach yourself, because they can be like, what are you talking about for free? Or they'd be like, oh, your price is too low for that engagement and everything. And I've even found that out. I've even learned that. Where even if you have sponsors for speaking engagements, if the organization isn't necessarily paying the speaker or anything, it doesn't feel like they have blood in the game as well. They may not market the event as much. They may not, do as much for the speaker. And then if they don't have as many attendees, then they can cancel on you. And you're like, wait a minute, like, this is my income that you just canceled and you didn't necessarily back me as the speaker who sat outside this time where I could have spoken for somewhere else. So I'm at the point where like everyone needs to have, skin in the game. It can't just be me, and it can't just be me giving free information. I because there's been times even I'll say like for coaching like a hygienist, and it'll be something very low cost and reasonable and everything, and they'll be like, oh, I just can't pay that at all. And it's like, well, I can't continue just to give you all this information for free and everything. And learning about boundaries is what makes you feel less bad about that, because that's just the fact of the matter, is that we have to respect ourselves enough to recognize that for people to make change, they have to invest in themselves. And if you're bringing about change and value to that person, then yeah, you do need to invest. If I'm having a conference and I'm having different people from large organizations come who are looking to hire hygienists, if you're saying that that's not worth anything and you get a whole wonderful gig out of this, then that's not really respecting all that I've done.
Mm-hmm.
Joffrey, any last questions before we end with our official last question?
No, I think we're good. I've really enjoyed chatting with Kari. She's got such wonderful insight and just this contagious energy. Kari, I always love to end these podcasts by asking, what piece of advice do you wish you could go back and give yourself when you first graduated?
When I first graduated, I wish I can go back and I wish I had a mentor or someone to guide me through the process, because maybe I wouldn't have had so many challenges. So I wish I had done that. But I also wish I had invested in myself more, like we talked about, and networked more with my colleagues. So I think that would have really helped me if I had attended more of my local ADHA meetings, or I've gone to the state meetings and everything. Because if you're networking with your colleagues, then they will be like, oh, I have a great job for you, a great position, and they pay well and they have benefits. But if you're just, finding the jobs online or at that time in the paper and everything, then, you don't know, like, avoid that person or whatever. And, you don't really get all the good deets and everything like that. So I think having a mentor is good. A lot of people are doing different coaching. Like, we talked about, there's different people who are out there to coach you through situations or through your career. And then also making sure that you're investing in yourself. Networking is key. That really is what can help you. Like with what I'm doing right now and the webinar workshop and everything like that, I'm contacting all my different people in my network and they're helping me out. And if you don't network, then you don't have that support system. So I think that's what really would have helped me. And then also money situations. Like I wish that they would talk about that in school as well, about, when we get out of school, that may be the most money we ever made in our life. And it's great when you're like younger, maybe in your 20s, but as you get older, did you invest properly? Do you have your retirement fund, all that stuff like that?
Those are all wonderful.
Now that
I wish I would have invested more in myself.
I wish there was a chapter in my hygiene book about preparing for retirement, about investing. That would have been huge.
Honestly, I feel like, I know that they have so much time. They're like rushing and they have so much time to teach us everything about the field and the scaling calculus and everything. But I feel like they do need to have a course somewhere in there of just life lessons. So there's one school that I talk to yearly, Hostas Community College up in New York. And I do a lunch and learn with them for one of the companies I work with. And then like 30 minutes, I talk to them about like challenges I've had, just real life stuff and everything. And the students love that. And I think that's what's needed, is that they have people come in and talk about these life lessons and talk about financial planning or self-worth and different things like that. So it can't all just be about perio and dental hygiene and everything, because that's why so many of us are burned out. We don't have those we weren't taught those different things in school. So it's kind of like with the joke when you're like, oh yeah, I know the Krebs cycle, but can I do my taxes and everything? So we need to learn those foundational parts as well, or we're not going to be the best hygienists because we're burnt out and everything. So that would be great. Hopefully schools will allow that somehow, or allow a webinar or something for the students and different people to come in. So that's one thing I'm trying to work on, I guess, as well with different students. I know a lot of us are trying to do that with schools to really help give back to the community.
Yeah, I love talking to the hygiene students before graduation. I've been meeting up with the different schools in our area, and it's so fun watching them listen to me.
Mm-hmm. Yeah, it's fun. It's fun. It's important to do that. It's important to do that. I did that last year. I talked to my local school and helped them out a little bit. And some of the students, they were like, the teachers told us not to ask for too much money, and I'm like, you better ask for all the money right now. Like, why are you trying to downgrade yourself? Like, you're not in the position where I was, where they, you just we ask for all the money right now, and like see where those chips fly and everything. Like, come on here. And so it's good to be able to like kind of guide them, because sometimes, honestly, all the instructors aren't as up to date, and we know that sometimes if they were to ask for like basic money or lower just to try to get the job, if you start that way, it's so hard for you to get raises at times in this field or anything. So it's like, it'll take you forever. But if they're offering more, take it. Like, what were you talking about? So mentorship is definitely good, or allowing people to have different perspectives is what's needed. And so that's what I wish I had when I first came out of school.
Love it. Thank you, Kari.
Welcome, guys.
Kari, thank you so much for chatting with us this morning.
Thank you. Can't wait to see you guys in July. We're going to have fun.
Okay. Bye, guys.